I'll start off today. For those of you who don't know me, my name is Tara Donnelly. I am the Head of Communications and Partnerships at the Hunger Project Australia. And it's really lovely to be with you all. Hi, Diane and Chris. I can see you saying hi. And Peter and Heather from Perth. Welcome. And Rick Ball, hello. There's lots of people joining in who know Badiul and Deb as well, which is wonderful. I do send our apologies from Melanie Noden, our CEO. She was so looking forward to being here with you all tonight, but unfortunately she has an injury which she's recovering from, so she's not able to be here, but she sends her love. I'll let you all know that we are recording this session, and that's so that we can share it with other people who aren't able to be with us today. It's really lovely to have so many people. We've got Felicity dialing in from Hong Kong, which is wonderful. Wow. So really a global call. And on that note, talking about place and where we are, I would like to begin by acknowledging the traditional custodians of the various lands on which we are all today, in particular the Gadigal and Bidjigal people. That is the land on which I am currently, and we recognise their continuing connection to land, waters and culture. And I also pay my respects to elders past, present and emerging. And I would also like to thank our presenting partner and friends at GJK Facility Services, who are partnering with us today and making today possible. Got a couple more people joining in. We've got a hi from Miles and also from Lenny in Germany, which is wonderful. Thank you all. For those of you who are joining the call who are just getting to know us at the Hunger Project, we see people living in hunger as the solution, and we shift mindset so people become leaders for a sustainable future and the sustainable end of hunger. This is the third session in this series that we're running, and for those of you who have joined the first two sessions, you will have heard about our approach to community-led development and how that's really helped our program countries and our teams around the world, including Badiul's, to respond swiftly and effectively to COVID-19. And we're going to hear a bit more about that today, in particular how that looks in Bangladesh. Many of you have met Badiul over the years, either in Australia or you've actually gone to visit him in Bangladesh. For those of you who don't know him, Badiul has been with the Hunger Project since 1991, so a very long time, and was instrumental in developing our unique Vision Commitment Action Workshop, which has to date been participated or attended by 1.8 million people, and is really such an important part of the Hunger Project's work. Badiul is the country director of THP-Bangladesh. And Deborah Protter, who's joining us today, as well as a member of our development board in Western Australia. She is also a long time investor in the Hunger Project and has facilitated a number of our leadership immersion programs. We're really lucky to have Deb and Badiul with us today. They themselves have developed a deep bond and friendship over many years, and that will no doubt come through in the conversation today. They've also collaborated on kickstarting the Women's Leadership Program in Badiul many years ago, and that still has developed a lot since you were part of it there, Deb. So on that note, I'm going to hand over to Deb and Badiul. I'll be joining you again at the end. So thank you so much, and we really look forward to hearing from both of you.
Thank you, and welcome everybody. It's lovely to see all those names of the people that we know and that Badiul knows too. It's just so great to be on this call and also to have you with us, Badiul. It's just a real privilege and an honor to have you with us. And, you know, the purpose of our connecting with you really today is to learn about what's happening in Bangladesh right now. We don't hear a lot in Australia, news from Bangladesh. So it's just really important, I think, that we get, given our work there is so important, that we get really an update from you about what's happening with COVID in your country, and also what's happening in terms of our work on the ground to combat COVID in Bangladesh. But to start with Badiul, we really like to know about how you and your family are doing. I know you've been in lockdown for some time, and you've been in your room for a long time, but you know, we just want to hear about what's been happening with you and your family.
Thank you. Thank you, Deb. It's nice to see you, and nice to see, although we don't see the pictures, but nice to have the opportunity to say hello to a lot of friends, and which we have developed friendship with a lot of people. And many of your fellow Australians visited Bangladesh, and we went to villages, and we had good time, and we had very memorable time. And also we visited Australia last time. We met a lot of people and made a lot of friends. So hello to everyone. Hello to Kay. Hello to George. And they hosted a nice lunch when we were there. My wife and I were there last year. And so thank you all, and welcome everyone. And as Deb said, that we had a little bit of rough time. My family, my two daughters and my wife and myself were infected. And it was like a storm. And I don't know whether any one of you experienced being in a storm, but it was rough. And fortunately, we recovered. And we got infected, even though we followed meticulously WHO guidelines, and very, very careful. In fact, I have not been out of home since 18th of March. But what it says is that you cannot be careful enough. You will have to be really, really careful. And we have fortunately, we have a son who is a doctor, who is an emergency room doctor, and he's a frontline responder. And he took care of us remotely. He's in New York, by the way. So, and because of the love, because of the good wishes, because of all the energy people sent, we recovered. So thank God. And we are maybe God kept us alive because He has a mission, so that we can continue this work. So thank you. Really being nice to be with all of you here today.
And Badiul, how are you doing now in terms of your recovery, you, Tazima, and the girls?
I think we are doing very well. My sleep got a little bit affected, but I'm close to 100%. And the girls, the younger one, got better. And my wife is also much better. Women are stronger sex, so they cope with it easily. But I'm close to 100%, and thank God.
Well, we're sending you all our love, and you know, for total recovery for all of you, and love to Tazima from all of us too. We know you're a pair. And so, you know, we just send you all our love too. And please pass that on to Tazima.
Sure.
Please do.
I will. Yeah.
So, Badiul, why don't you just let us know what's happening in Bangladesh right now with regard to COVID-19? As I said, we don't know that much here. I know that it's out of control a little bit from what you told us, but if you could just tell us what's, you know, what's caused that, what is happening, and, you know, what you think are some of the reasons for that.
Well, I wish I could say good things. I'll say very positive things about COVID situation here, and it's spreading, unfortunately, and we don't know how much is spreading because the testing is very limited. And the statistics we have is we have about over 200,000, 223,000 exactly who got infected, although the testing is very limited. So that is not the exact number. And about 2,900 people died. And that's not a huge number, but a significant number. So, and it's at the community level, which is in every village and every neighborhood. That's the bad part of it. And unfortunately, the way we try to deal with it is like the way the Americans try to do it, although there is a lot of difference in terms of our infrastructure and also resources we have. And the American president, there has been a lot of bragging and a lot of misleading statements. And we had that too in this country. And also we have very poor health infrastructure. And we do not have enough ICU beds. We do not have enough ventilators, and the health infrastructure is in poor shape, very, very poor shape, not ready to cope with this pandemic. And also there is widespread corruption, and we see headlines every day in the newspaper locally. And so the corruption also made things worse. And on top of it is we have autocratic decision making, unfortunately, and jailing of some of the dissenting voices. And so all the expert opinions have not been taken into account. And so our Supremo, the person who holds all the power, basically made the decisions. And there is political divisiveness, and this is a pandemic that doesn't discriminate. It affects everybody. So we should have had a national program. Everybody should have been part of it, but it has not been that way. And also there has been trust deficit. Unfortunately, a lot of bragging and misinformation, and as a result, in this kind of situation, you need to, the citizens and the government and the leaders must work together, and there must be a relationship of trust and confidence. And unfortunately, that has not been developed. And also we made some mistakes and not well thought out plans. Instead of lockdowns, we declared general holidays. So people moved to villages and came back. And this is the way the virus spread all over the country. And so this is actually threatening the lives and livelihood of a lot of people. And a lot of people became vulnerable. And you know, in Bangladesh, unlike in Australia, is the informal sector is the prominent sector. About 90% of our people are employed in the informal sector. Small shopkeepers and mom and pop shops, and also the day laborers and agricultural workers, and they live from hand to mouth, and so they have been very badly affected, so this pandemic is threatening not only lives, killing people, but also threatening livelihoods. A lot of people out of jobs and are on the verge of starvation. And one prominent group is the garment workers, and we have about 4 million young women, most of them, who are working in the garment sector. And because of the cancellation of many orders by the buyers from abroad, so many of them lost jobs, and many of them are underemployment, if not fully unemployed. And during this time, during this trying time, there are a lot of pressure on people who lost their jobs, and violence, especially against women, increases. So we have been seeing signs of that. And also we have been seeing signs of the child marriage. People cannot feed all the mouth they have to feed. So they are marrying of their daughters. So many factors are responsible for the present state of affairs. And unfortunately, the virus is not under control. It's still expanding.
Thank you. Thanks, Badiul. Before we look at what we're doing in Bangladesh as a hunger project, we just want to take a look at a little video looking at our work in Bangladesh, what we've been doing really over the years, Badiul. in developing leaders. Just for those people who haven't been there, have not got the background of the Hunger Project, before we talk about how we're dealing with this in Bangladesh. So I think we're just going to see a little video clip now.
In Bangladesh, 24 million people live below the poverty line, barely scraping by day after day. 1 in 3 children is malnourished, already behind before they've even gotten started. Half of all girls are married before they turn 18, forced to become adults before their time. In the face of enormous challenges, a movement is awakening across Bangladesh. People's innate capacity for vision, commitment, and action is being unleashed to end hunger. We are moving from I can't to I can to we can. Together, we are stopping child marriages and empowering women to be leaders. We are building resilience to the devastating impacts of climate change. We are enabling people with the knowledge and skills they need to build vibrant, sustainable economies. We are creating stability and cohesion so people live peacefully side by side. And holding our governments accountable to the things we are entitled to. We are facing into the future as one, building a self-reliant future free from hunger and poverty. We invite you to join the movement to end hunger. Invest in a self-reliant future for Bangladesh.
Okay, Badiul, let's then look, really what we want to look at is the Hunger Project strategy in Bangladesh is the mobilization of thousands of volunteer leaders, and that's really what you've been working on since 1993, is developing this body of leaders and working with local government. So how has your work developed on these fronts over the years so that you could take on a strategy for combating COVID-19?
Thank you. In fact, you are part of it.
Yes.
And some of our friends who visited Bangladesh contributed to it in many ways, and your support especially was very helpful. You know, when the virus became the part of our scene, and it was a shocker, and everything came to a standstill, because this is not the way we are used to doing things. We are used to going to the villages and mobilizing people, and so we didn't at that initial shock, we didn't know what to do. But very soon we realized that we have great assets throughout the country. And as you said, over the years, we have trained thousands and thousands of people. And in 1993, we started the VCA, the Vision Commitment and Action Workshop. And to lead that workshop, we trained thousands of animators throughout the country. And then later, we started training women leaders. And early on, we started training youth leaders. So huge number of volunteers, thousands, hundreds of thousands of volunteers all over the country. And also, then we came to realize that local government bodies, local government leaders are the leaders of the community. And they have access to resources. So if we work with them, and our work could magnify, could work better. And so we started working with the local government bodies starting from 2000, year 2000. And in fact, in a sense, those of you who are familiar with our the Hunger Project, four pillars, working with the local government, mobilizing the community, working with the women, and then partnership. And most of these, if not all of these, came from Bangladesh, from our experience. So we are happy to contribute contribute the tools. And so this is the infrastructure we have created. Then we later the development goals came. So overall improvement in the lives and lives of the people, health, education, nutrition, income generation, and all of those, and environment and governance. These things became important priorities. So for this reason, to achieve these developmental goals, and overall development goals is nothing but overall improvements in the quality of life. And so we have created in the villages, using these volunteers network, the village development teams. And also we have mobilized the ultra poor, poorest of the poor, and most of those are women, and they form self-help groups. So this is the huge infrastructure we have created over the years. So we felt that we don't have to feel helpless, and this is the infrastructure we can use, we can leverage on. That could be the foundation for our next set of activities to combat this, to face this virus that is threatening lives and livelihood of the people. So from this, using this foundation, using this infrastructure, using these assets, using this huge network of volunteers, we have started the Corona Resilient Villages. And basically, this is the Corona Resilient Villages gives the community the responsibility to protect the community. And it basically, the Corona Resilient Villages involves realizing that we are in it together. So we'll have to face it together. And we both individually as well as collectively, we'll have to contribute toward controlling the virus. And so it's based on sense of community and community ownership. And from that, so initial shock, initial sort of uncertainty led to our realization that we must use this asset that we have, and started the Corona Resilient Villages in about 1,500 villages around the country now.
Badiul, I always remember when I first came to Bangladesh, you were so passionate about one thing at that point in time, which was like unleashing the potential of Bangladeshis. And I think that's what you have accomplished in terms of exactly how many volunteer leaders do you now have in Bangladesh?
We, over the years, we trained close to 750,000 volunteers, but then they work with a lot of other people. So it's difficult to really pinpoint the number, but hundreds of thousands of people.
Yeah, and I think it's sort of hard, Badiul, for us to imagine, because actually what you are able to make a difference in is in the whole country through volunteer leaders that
Exactly.
You have spent years training and investing in those leaders. Because that's what I know, that, you know, initially we trained 30 women. Now there are tens of thousands of women now leading in their villages and probably leading this
Exactly.
COVID.
Exactly. And in fact,
Yeah.
the idea is that Bangladeshis will have to take responsibilities for the future of Bangladesh, the kind of Bangladesh they want to have. So we started BCAs, we started animators training to bring home that realization, and people taking a stand And we take the responsibility for a self-reliant and dignified Bangladesh, where people will have a self-fulfilling life and dignified life. So we mobilized youth, we mobilized women, we mobilized gray-haired people like me, and we mobilized people from all walks of life. And we also use the constitutionally mandated institution, which is local government system. And so it's a movement we have been trying to unleash. And the idea is that Bangladeshis will have to create the Bangladesh they want. And it's up to us. And obviously, we appreciate the support and the partnership of others. But that's the idea, that we have to be in the trenches. And so all these investment went into developing that mindset and also unleashing the leadership of these huge number of people.
So I hear, Badiul, that recently you invited somebody who's an epidemiologist from the Bangladeshi Institute of Epidemiology to go out into the villages with you to actually see what we're doing. Apparently this person wrote an article in the leading Bangladeshi paper where this is a quote from him I have, where he says, if the Hunger Project strategy was replicated throughout the country, then COVID could be under control in 4 weeks.
Yeah.
So so share with us what he saw. I know you've got this 4-step strategy, but what did he see that had him feel so confident that that would be the case?
Well, it's not only him. Fortunately, there are a lot of people who visited Bangladesh, who visited the rural Bangladesh, where we have this corona resilient villages being created, and unfortunately they had to do it virtually. And so we have been holding this dialogue sessions, and we held quite a few already, where a lot of distinguished people, including ministers, and we had our planning minister join the first one. So they have been hearing from the people in the trenches, the people who have been creating these volunteers who have been creating these corona resilient villages. Corona resilient villages, you know that it's not going to go away, and we are not we are not sure when we'll have a vaccine. And even if we have a vaccine, whether it will be safe, and when it will come to Bangladesh, when we'll have access to it. So we'll have to live with it, and that's the idea of corona resilient villages came. And so a lot of experts, not only this expert, but also a lot of experts heard from the volunteers, and they felt that this is the way. This is the way to really bring the virus under control. And as I said that in our first dialogue, the minister was there, the planning minister was there, and the former secretary of the local government, they said that there is no alternative, but this is the way. We'll have to mobilize the community. We'll have to take people the responsibility. We'll have to have community engagement. And this is part of the, by the way, WHO guideline too. So
Badiul, we need to hear about your 4-stage strategy.
Okay. The 4 stage. So corona resilient village, as I said, that this is the people taking responsibility for their own villages. And the first step is realization that we are in it together. We'll have to fight it's already in our village. It's already in our neighborhood. So if we all join hands, we all work together, then we'll be able to contain where it is those people who are already infected. So it's community taking responsibility, community taking the initiative, community taking the ownership. So that's the first step. And this is, since we have this village development team, we have these self-help groups, we have these volunteers, they have been able to bring the villages together, and they take a stand that we are going to contain the virus, and we are going to make sure that it doesn't spread any further. So that's the first step. And second step is that it's very infectious virus. So we'll have to be very careful. The second thing is try to change the behavior of the people, which is not easy. And behavior change takes the time. But the realization that we are in it together, and this is in a sense self-interest driven. By changing my behavior, I'll be able to protect not only my neighbor, but also protect my loved ones, protect myself. So in terms of behavior change, we have been carrying out the 3W campaign: washing hands, and another W is watching distance, and the third is the wearing masks. And so these are the things that we have been trying to promote. And part of this also, there are a lot of misinformation, disinformation, and I'm sure you come across this misinformation, disinformation. So we have been enrolling the imams, the religious leaders, the community leaders who have been dispelling this misinformation through sermons. And so this is the second step, the communication and dispelling misinformation, disinformation. Idea is to change the behavior, and this is a continuing process, and this doesn't happen overnight. So our volunteers are carrying it out. The third thing is that those who got infected, they need help. They need to be isolated. So they take this step to isolate them and also get the medical help and get tests. And those who came from outside to the community, to the village, and they need to be quarantined. So our volunteers have been doing that, quarantining, putting the newcomers into quarantine, and also make sure that those who are infected, they are isolated and they get the medical help. And the next step, oh, by the way, another thing that happens is that those who got infected, they are stigmatized many times, and but this is not their fault. So we try to make people aware that these are our loved ones, and this is not their fault. And so and we'll have to. They need help rather than our animosity. So we have been making people aware of against this stigmatization, and also in this situation, as we talked about before, child marriage and the violence against women takes place because people lost their livelihood, so there are pressure on them and additional pressures. So people at times cannot take pressure, so they unleash on women and the children, and to reduce their burden of feeding everybody, they marry off their daughters. So these are the things that we have been doing. The fourth step is that we have been catalyzing. We have been catalyzing help through community philanthropy. So these are the common people, ordinary people, the villagers themselves who chip in and who contribute food, who contribute cleaning items, who contribute money. And so this is through community philanthropy. They have, in fact, by now about 400,000 they have worth of food and other items they have collected, and they have been distributing among those people who have been on the verge of starvation. And also they have been making list of people who lost their livelihood, day laborers, and who are on the starving. And they and especially identifying the female-headed household, people with disability, people with small children, and working with the local government bodies so that they get government support. So these are the 4 steps. We are in it together. We'll have to do it together. Communication, change behavior. Third is isolation and quarantining and getting help. And fourth is standing by the people who are on the verge of starvation and helping them.
Brilliant. And thank you so much, Badiul. We're going to actually see what this looks like in reality, because we're going to have hopefully we're going to have a video now. And the video is actually from right now in Bangladesh. and the video is of a woman who's a leader in her village. I think she got trained in 2007, and in 2013 she became a leader. She's the headmistress of a state primary school. She's a single parent with one daughter, and she's going to tell us about what's happening in her village to make it COVID safe.
আমি আঞ্জু আনোয়ারা ময়না, পেশায় শিক্ষক, সভাপতি ভিডিটি শাখারিয়া, গোপালপুর, টাঙ্গাইল। কাজ করতে ভালোবাসি স্বেচ্ছাব্রতী হিসেবে, মানুষের পাশে দাঁড়াতে ভালোবাসি বিভিন্ন সংকটে। বৈশ্বিক মহামারী কোভিড-19 প্রভাব যখন বিশ্বব্যাপী ছড়িয়ে পড়ল, তখনই মনে হলো নিজেকে নিয়ে যে কিছু নতুন করে ভাবতে হবে। আর বাংলাদেশে যেদিন 8 মাস শুরু হলো আমাদের রোগী শনাক্ত, সেই দিনই আমরা ভিডিটির সদস্যরা নতুন করে গ্রামকে নিয়ে ভাবতে থাকি এবং পরিকল্পনা করতে থাকি কিভাবে এই কোভিড-19 প্রতিরোধ করা যায় এবং নিজের গ্রামকে কোভিড-19 মুক্ত রাখা যায়। আমরা মোবাইল ফোনে ভিডিটির সদস্যদের সাথে যোগাযোগ করতে থাকি এবং তাছাড়া শারীরিক দূরত্ব বজায় রেখে আমরা কিছু মিটিং করতে থাকি এবং আমাদের সাথে আরও নতুন কিছু মানুষকে যুক্ত করার সিদ্ধান্ত নিই। কোভিড-19 স্বাস্থ্যবিধি মেনে চলা বিষয়ে প্রচারণা, উঠান বৈঠক, সঠিক পদ্ধতিতে হাত ধোয়ার অনুশীলন, হ্যান্ড ওয়াশ ব্লক স্থাপন, সাবান, মাস্ক, হ্যান্ড গ্লাভস, লিফলেট ইত্যাদি বিতরণ, জনসমাগম এলাকায় শারীরিক দূরত্বের চিহ্ন আঁকা, কর্মহীনদের তালিকা তৈরি, ডোনারের সাথে যোগাযোগ রাখা, ঘরে ঘরে খাবার পৌঁছে দেওয়া, উপহার সামগ্রী পৌঁছে দেওয়াই ছিল আমাদের এর পর্যন্ত নেওয়া বিভিন্ন কাজগুলো করতে গিয়ে আমরা বিভিন্ন চ্যালেঞ্জের মুখোমুখি হয়েছি এবং সেই চ্যালেঞ্জগুলোর মধ্যে সবচেয়ে বেশি ছিল ধর্মীয় গোঁড়ামি, এলাকায় প্রচলিত বেশ কিছু কুসংস্কার, এছাড়াও ছিল মানুষের কিছু নিজেরা যা ভাবছে সেই অবস্থানে ঠিক থাকা এবং আমাদেরকে প্রথম দিকে অসহযোগিতা করা। তবুও আমরা এই বাধাগুলো অতিক্রম করতে পেরেছি, মানুষের মধ্যে সচেতনতা বোধ সৃষ্টি করতে পেরেছি এবং আমরা বিশ্বাস করি যে আমাদের গ্রাম কোভিড-19 মুক্ত থাকবে এবং আমার এলাকার মানুষ স্বাস্থ্যবিধি মেনে তারা চলছে এবং চলবে। ভবিষ্যতে যাতে গ্রামের মানুষজন, এলাকার মানুষজন কোভিড-19কে প্রতিরোধ করতে পারে এবং সহজেই এ থেকে মুক্ত থাকতে পারে, করোনা সহিষ্ণু গ্রাম গড়তে পারে, সেই লক্ষ্যে আমরা আমাদের এই ক্যাম্পেইন এবং অন্যান্য কার্যক্রম চলমান রাখব। ধন্যবাদ।
Making that available makes everything
Sure.
very real. So
she's a woman leader.
I know she is a woman
and you
leader.
started this revolution, and
She's
Felicity was
fantastic.
part of it too.
Yeah. So Badiul, we're coming to the end of my little interview with you, but just before, my last question is, what is needed from your end to meet the challenges that you're facing? What do you need?
Well, you know that a health emergency is going on, and also it impacted a lot of people, a lot of the livelihood. So we need the partnership in those areas. Some emergency support is needed, and say in many of the healthcare facilities we have, they do not have basic instruments or basic things. For example, they do not have oximeter. They do not have the thermometer for measuring the fever. And so we need to provide these things to our healthcare centers at the village level. And also, a lot of people lost their livelihood, and emergency support such as one of the sources of nutrition is vegetable, and they could be cooked, they could be quickly produced. So we have been giving, and we want to give more seeds to the families and poor families, and so that they will be able to grow food. And right now there are support available, the emergency support, emergency food relief, but over time that will dwindle. So we want to have them grow in their around their homes, homestead gardening.
Right.
And so we want to give the vegetable seeds, and we want to give these instruments and these small things to the healthcare centers, so that they can do their good job, and also PPEs to those health personnel.
Great. I think we just need to leave some time for questions, Badiul, from our community. So I'm just going to hand back to Tara, who I think has got, I could see some questions coming up on there. So Tara, I'll hand back to you so you can ask those questions.
Yeah, thank you. Thanks, Deb. Thanks, Badiul. There are quite a few questions coming in. One that I thought might be nice to start off with you, Badiul, was a question from Diane, saying that her husband, Chris, says you haven't changed at all since he met you in Bangladesh in 2007. What is your secret?
Well, I'm sitting on the same table that we sat with her husband. And so I have fond memories about having lunch with him. And I think the work that I do is very, very enjoyable, and I see the difference. So that makes me feel good. When you feel good, you perhaps preserve yourself better. And I also try to take care of myself too. And thank you all for your partnership. And Diane, please say hello to your husband. And we still remember the time we spent with him.
Oh, wonderful. I think Chris is with us today, so he's watching
Good.
this. So another question from Roger, Badiul. You mentioned the corona resilient villages and the strategy that you're putting in place there. Roger's curious to know if you could say a bit more about how the COVID resilient villages are different to other villages that are not working with THP currently. Have you seen differences in the daily life between the two, and what are the results that you've seen in the COVID resilient communities?
Well, a lot of differences. These are the villages where people took the responsibility, people providing leadership, and people brought together the forces of good, communities together, and also creating campaigns, vigorous campaigns to change the mindset, to change people's behavior, unlike in other villages. So we see the virus is contained, and there are mitigation efforts. And those who are infected, they are not stigmatized. They are getting help, unlike in the other villages. And in other villages, the virus is spreading, and in these villages they are contained. So there are a lot of differences. And in these villages, most importantly, took responsibility for their own well-being as well as own futures. So that's the difference, and thanks to all of you for your partnership, for your support, which made this work possible, which is the foundation of the COVID resilient villages.
Beautiful, thank you. And maybe actually just leading on from that, another question that we have from Claire is whether you could share with us a story of how people have demonstrated their leadership to combat COVID-19 in a way that has even surprised you. And I guess she's saying, you've been doing this work for so long. Did you see anything particularly this time around with COVID that surprised you in people's leadership?
Sure. Kay and everybody, I'm surprised every day by the courage, by the leadership, by the commitment, and by the seriousness of these people. And COVID there was a panic and everywhere. So we are not sure whether these people will come out of their home or take the initiative to mobilize others and to take the action and provide the leadership. And we very soon realized that they are ready. And we had some hesitation. We had some a period of 1 or 2 days. We are thinking of what needs to be done. So people were ready to protect themselves, protect their loved ones, and protect their neighbors, protect their. It's a sense of community, and this is happened over the years as a result of a lot of hard work. And so yeah, it was surprising. I mean, this is a panic, and people's lives are at stake. And but they practice the social distancing, the physical distancing, and also they protected themselves and maintained safe distance to do this work. So yeah, a lot of young people are involved in it, and they enroll their parents, they enroll their neighbors, they enroll the imams, religious leaders, everybody, and the elected leaders.
Well, actually, on that point, one of the other questions that's come in is on that point of about mosques and churches and how they're dealing with people getting together for worship. How have people managed to be able to do that, or is that still happening?
You know, that has been the biggest challenge, I must say. There are religious superstition and misinterpretation of the religion, and so and many people felt that, oh, if Allah wants to give it, I can do anything. And so we maintaining distance while they are praying was also a challenge. But we have been able to enroll the strategic step that our volunteers took was to enroll the imams, the religious leaders, and the village elders, and they gave sermons, and they made people realize. Then I think in most cases where we are working, in almost all cases, and some cases where the work has started late, so people are abiding by those. And in some places, you know, with physical distancing, especially Friday prayer, and there is not enough room. So they are trying to have 2 congregations, more than 1 in some places. So yeah, this has been a challenge, but with commitment, power of commitment can overcome any challenge. So our volunteers has surprised us with their depth of their commitment.
Thanks, Badiul. We've got another question that's come in just now from Felicity to you, Badiul. How much money would make a difference to provide the necessities that are missing?
Well, thank you, Felicity. Hello, and hello to your family. And so the needs are enormous, and the more resources we can get, we can help, we can support more people. As I said, that some essential things that need to be given to the health facilities, and also some emergency support, which will support them for medium term, not longer term. Those support are needed. So enormous needs are there. Say, I could give an example. Say if we have $100,000, and this could provide support to about 200 families in a union, and we could. Union is a cluster of villages. This is the lowest level of local government, and we could about 96 unions with a population of over 2.4 million to 2.8 million people we could reach with this support with $100,000. And this could provide these emergency gadgets, and as well as very bare minimum support to the poorest of the poor. So the more resources we have, better it is. So I gave you an example of what $100,000 could do.
Did you say it would impact 2.5 million?
About, yeah, 2.4 to 2.8 million people with $100,000. And and bare minimum support. Obviously, with more money, we can give, we can go deeper. We can give support to more people.
Wonderful. Thanks, Badiul. We are getting close to the end, but there is a couple more questions. And one, actually, this is something that has been in the news here as well of late. Badiul, you know, you talk about all these different challenges that people are dealing with, but we've also heard about the monsoon flooding in parts of Bangladesh. Can you talk a little bit about that and whether that's impacted areas where THP is working, and if so, how animators have had to deal with that?
You know, Bangladesh is a country of, unfortunately, these natural disasters, and some are man-made too, unfortunately. And we had now flooding in the northern part of Bangladesh, and really bad. And you know, in the past, the water would recede quickly, but this time it's staying. And so a lot of people do not have places to sleep. And they took shelter on the embankments and other things. And so people are in real distress. And before that, we had the cyclone in the south. So cyclone in the south, the flooding in the north. So people are in bad shape, and now people are trying to survive in these challenges. COVID on top of it, so it's a double whammy. As you would say in the West, and so they are trying to deal with it, and it's a very challenging situation, and unless you are in it, it's even difficult to fathom.
Thank you. And maybe, you know, related to that, but not just specifically, we had a question from Kay, and she says, "We are all supporting you in our hearts and commend you on the work being done by everyone in the communities," and asks, you know, because I guess it's hard for us to imagine how families do manage isolation and quarantines when people are living in such close proximity. Could you tell us a little bit about that? I mean, you even said yourself you have not left the house for quite some time.
Jay, thank you. Hello to you. And she was planning to come to Bangladesh, and it will happen. So we'll make sure that it will happen, and this will situation will improve, and we'll have you and a lot of our friends in Bangladesh. So this is hard. You know, many people in the cities, in the slums, and also in the villages too, poor people, they do not have separate rooms, separate houses to quarantine. So in some cases, institutional schools and other dwellings that people have are used for quarantining, putting people into quarantine, and also isolation. And also we are working with a group of young architects, and they have come up with a very interesting low-cost design, not only to convert the facilities which are schools and others for isolation, but also low-cost structure they can create. So we have been working with those people, and very young, dynamic, and committed architects. So it's hard, but we are doing the best we can and trying to force partnership with others to deal with it. And also we are trying to we are now about in 1,500 villages, and this needs to expand, as the expert said, that if this could be upscaled and we could bring this thing in a month, bring this thing under control in a month. So we are trying to work with the government. We have approached the government, and also we are trying to work with forge a partnership with BRAC, the largest NGO in the world, not only in Bangladesh. So we are trying to work with others so that the whole country is mobilized, and all the people of Bangladesh are safe, and all the people of Bangladesh are protected, and they also have what is needed to cope with this emergency.
Beautiful. Thank you, Badiul. We are coming just to the end of our time with you. I know we could talk for hours and hours, and I know you love to do that too.
Sure.
Deb, is there something that you would like to say at the end in sort of what you've taken from today, given just your, all the work that you know of in Bangladesh and Badiul?
Yeah, I think what I want to say, Badiul, it's such an honor to have you on this call, and you're such, what you've created since 1993 is this whole incredible mobilization of leaders, which is so inspiring. And Felicity and I had the opportunity a number of times to work with these leaders, and so I have a sense of what you've unleashed, really, which is hard to even fathom when you haven't been there, but it is the unleashing of the human spirit. And I think, Badiul, you are an epitome of that unleashing of the human spirit. And we want you to look after yourself and your family so that you can continue to provide the leadership that you do. And it's just a privilege to be with you today, and I'm sure for everybody else who's on here. And it's also, I think, for all of us who are on this call, it's great to be in partnership with you. We're far away from you, but it doesn't mean to say that you're not always in our hearts. And so it's just very important that we hear from you, and so thank you.
Thank you. I just want to add, my vision is to take all of you to the villages to see and experience yourself. And well, this pandemic also created an opportunity. So we can take you virtually. And in fact, we can arrange dialogue with the community volunteers who are spearheading, leading this work. So I know it will be a little bit challenging. We'll need translation, but if you are Taram and your colleagues, if you want to arrange, and even our volunteers, if you want to arrange for, say, the volunteers from Sydney or Melbourne to connect with one of the regions or some of the volunteers, and we could have you could actually have a visit virtually of the village.
Wonderful. We'll take you up on that offer for sure. We've got a few people in the chat already saying they want to be part of that. So thank you for that offer. That would be great. So thank you so much, Badiul and Deb, to both of you for leading us through that today, and for everyone joining us on the call today. Thank you also to GJK Facility Services for partnering with us. We will share the link. We'll email you all tomorrow a link to this recording if you want to share it with anyone else, but also to the 2 videos so you can have a chance to watch them properly at home, because they both tell great stories about the work that you're doing, Badiul, in Bangladesh. Thank you also from the Hunger Project Australia for everyone who has invested, particularly of late through our Stay and Reach Out campaign, and in other ways. We know that it's a tough time for many, but we've been just so pleased and pleasantly surprised by people's generosity. And as you've heard with Badiul today, it really does make a difference at the moment. So thank you so much to everyone who's done that. If for any of you some ideas have sparked from what Badiul has shared with us today, and you'd like to talk more about making a difference in Bangladesh specifically and how you can partner with Badiul and his team there, please reach out to me or Melanie, our CEO, or anyone from our team, and we can talk to you more about that. Or you can go to our website. It's always open and ready for making investments, so you're welcome to do that anytime. But really, it's been so great, as Badiul said, to be able to have these virtual meetings and be able to connect with you here. But I love that idea of, connecting with some of the leaders. So I think we'll definitely take you up on that offer, and we'll let everyone who's on this call know when we do that. So thank you again for everyone for being with us tonight, and thank you, Badiul and Deb. Really appreciate it.
Thank you.
Thank you.
Thank you. Yeah, it has been a great honor and a privilege to be with all of you.
Thank you so much.
Looking forward to seeing you in Bangladesh.
One day, hopefully soon.
Physically later.
Yeah. Excellent. All right. Thank you, everybody, and have a wonderful night.